Good morning, everyone. It's Bob Ravenscroft, Vice President for Advancement for our August 13th, 2020 press briefing. We have with us today Russ Gronewold, the CEO of Bryan Health, and Dr. Rich Lloyd, the President of Bryan College of Health Sciences. They have some exciting news to share, so I'll get right to our COVID-specific statistics. Then we'll turn it over to them and open it up for questions. Our midnight census was 499 patients. Yesterday we eclipsed 500, and I believe that was the first time since we had to begin backing things off that we eclipsed 500. So things are definitely busy and kind of back to normal in many respects here. Before the testing statistics, an update on our testing supplies. The Cepheid test that we've talked about is really at its most critical stage that we've had in a while. We're expected to receive our scheduled allocation tomorrow, but as of this time, we are coding that critical. We have 2 days of test on hand. Luminix, we're in the caution category. We have 28 days on hand with scheduled allocations, and then for our routine swabs and so forth that are then sent to LabCorp, we're in very good shape. We have now administered 18,831 COVID tests through Bryan Health. Our positives are 2,165, and the LabCorp operation out of Kansas City or Overland Park is really doing a great job. We only have 98 pending tests. Right now in the hospital, we have 8 COVID patients. 3 are from Lancaster County, 5 are from outside of Lancaster. Total in-house that are either positive or pending are 14. So pending results, 8 of them are from Lancaster County that are hospitalized, and well, that counts those that are also positive, the 3 that are positive, and 6 positive or pending are from outside of Lancaster County. We still have 2 on ventilators here in the ICU at Bryant that are COVID positive. With that, it's my pleasure to turn it over to Russ Gronewold, the CEO of Bryan Health, to provide an exciting announcement.
Well, thank you for having us today again back into your areas. As you know, Nebraska, like every other state in the United States, faces a shortage of healthcare workers both now and looking forward into the future. COVID has only served to solidify the need for a workforce strategy for all of the kinds of healthcare workers, especially nurses, but healthcare workers across the spectrum. Bryan College of Health Sciences has continued to address those needs, do its part by increasing enrollment over these last semesters. In fact, 4 semesters in a row with record enrollments, and possibly one, we're awaiting the final results, possibly one even this coming fall. We serve students from all over Nebraska and return roughly 45% of those back to the rest of Nebraska again when they graduate. I'm excited today to announce another initiative to address healthcare workforce needs in Nebraska. Bryan College of Health Sciences and Hastings College are announcing a partnership, an education partnership, to develop a healthcare workforce strategy for South Central Nebraska. Lots of planning is going to happen over the next several months, but the end goal is this, that in the fall of 2022, we will have our first classes at a second Bryan College of Health Sciences site in Hastings. Why South Central Nebraska? A lot of reasons. Bryan has healthcare partnerships with hospitals and communities, and that's part of our mission all throughout Nebraska. We continue to look for different ways to engage those healthcare partners there. We also have investments in that area. So as an example, Merrick Medical Center in Central City, Nebraska is part of the Bryan system. Grand Island Regional Medical Center, which opened up just last month in Grand Island through a joint venture with physicians, with the community members, with Mary Lanning Hospital. They're part of the Bryan system. And we have a joint venture with Mary Lanning Hospital in Hastings for cardiology services. We've had that for some time. So in essence, that joint venture is also part of our system. And we need a workforce strategy there to continue to support our investments in that area. A lot of keys to success, but none greater than this one. Rich Lloyd is going to be, while maintaining his role as the president of Bryan College of Health Sciences, the executive president of Hastings College. Rich is from Hastings. Rich grew up there. He went to college there. He was a professor there. He was an administrator there before going to Vermont and then coming back to Bryan. He's led a tremendous growth at our college here at Bryan College of Health Sciences, and he is uniquely positioned to understand the needs of South Central Nebraska, the capabilities of Bryan, and to merge those into a really dynamic strategy to continue to address those health workforce needs. So with that, I'm going to introduce you to Dr. Lloyd, and he's going to give you a few more specifics about this.
Thank you, Russ, very much. Good morning, everyone. As Russ mentioned, I'm Rich Lloyd, president of Bryan College of Health Sciences, and now into my 5th year serving in that role, and what a joy it has been and continues to be. I'm really excited to announce today that beginning September 1st, I'll also have the pleasure to serve as executive president of Hastings College. As a graduate of Hastings College, it is truly a special honor to have this opportunity to serve my alma mater in this way. Often in higher education, we see colleges competing against one another. In this case, though, 2 amazing colleges that have a combined history of over 200 years of educating students are modeling how we can find innovative ways to work together. So we are collaborating, focusing on meeting the needs of our students and the current and future workforce needs of our communities and state. We certainly know we need to expand our healthcare workforce as we face continued shortages in key areas like nursing, just as one of many examples. While I'm the one at the podium, credit and thanks goes to those who do the work, talented and dedicated faculty and students engaged in learning, and to our student-centered staff and administrators ensuring resources for success are in place and available. They, along with other community partners, will be at the center of conversations as we consider what's possible, what's doable, what's needed, and what we can do here and what we can do in Hastings and South Central Nebraska. My role then is a connector, supporting and meeting the mission of both institutions and keeping these really interesting and innovative conversations going. And my connector role will also include considering additional partnerships or opportunities that benefit each respective campus. The goal is clear in our work together: to create educational and career pathways of benefit to our students that serve both campuses and the larger communities we serve and have served. We really look forward to sharing updates and more good and exciting news in the days and months to come. Really grateful for the opportunity, look forward to what's ahead. Yes, so we really see, given the quality of both campuses, both amazing private institutions, and I've had the honor then to be a part of both of them, with the talent already on campuses, that we're going to see so many things just sort of going on as usual, and at the same time, new energy, additional conversations around when we take our curriculum, Bryan College of Health Sciences curriculum, and look at the Hastings College curriculum and say, where are there additive intersections for student learning? What can we do together? Where are emerging workforce needs in healthcare? And so how could we look at a curriculum combination, thinking about a crosswalk of the curriculum that would be additive for both campuses? And then do we have students interested in that? And then how do we get those things in place? So that's really fun. Building curriculum, talking with faculty and staff, getting everybody together to say what's possible as we think about the interests and needs of our students that we serve and the communities that they will live in. What can we do working together? So taking sort of a focused healthcare institution, traditional liberal arts college, thinking about career pathways, lives of meaning and purpose, and sitting down and saying, let's really have a lot of fun and figure this out is really, really exciting work. Some of this came about because these conversations were already happening. So last fall, a team from Hastings College met with a team from Bryan College of Health Sciences to just sort of initiate that conversation and say, okay, so here we are, what might we do together? And as the months have gone on, we've considered more and more what those possibilities might look like. And then talking with the faculty staff of Hastings, faculty staff at Bryant, and the boards, we said, let's give this a shot. This is a way in which we could get this done and bring a connector in that can help facilitate it and move us forward. Well, as I mentioned before, I'm deeply honored. The heart is racing right now, and deeply humbled to serve here and to serve at Hastings College in this role. The Lloyd family has 75 years of combined work experience at Hastings College. I'm a graduate, and our two children are both graduates as well. So a deep love for Hastings College and a deep love for Bryan. So to be asked to play that role, to sort of be at that intersection of two amazing, again, as I've already said, institutions, and have the opportunity to see what's possible together, how we can support one another, it's just an absolute honor. Just really, really excited about what's ahead. In terms of just the work, I think, again, as I've mentioned, we have real talented people on both campuses. I mean, there are days when I'm not here, obviously, and days and out and about, and this campus just continues to move forward in amazing ways. Talented faculty, staff, and administrators. Hastings College equally the same. And so it's really more about how we find the time to get everybody together than sort of where I'm going to be at each moment of each day, and everybody's eager to do that work. So the exciting thing now is going to say, let's get those calendars merged where we can get our faculty and our staff together to talk further about what's possible and what we've already imagined. So I think what we're certainly seeing in higher education, it's one of those things, it's always nice if you can own everything on your own. But there's also times when you combine strengths and look at what's most valuable for our students and how do we create those pathways on behalf of our students. And so here at the college, we've already done that as well with Bryant. We have an early college access program for high school students. We're partnering with other organizations. We have an announcement coming out as well soon about additional partnerships for students here in Lincoln. And when we think about Hastings College, similarly the same thing applies. Hastings College already has existing partnerships with other educational institutions. And really the goal is always to benefit students, right, to provide those pathways for student outcomes. And so those career opportunities, vocational opportunities are there when they're done. What we're starting to see across the country in higher ed, and now it's really starting to see in private ed. This is more common in public education and not necessarily as much so in private higher education, is where whether it's curriculum or some shared faculty resources, some shared online services, or even some additional office services similar to having a president serve in this role, we're really having that conversation in the private higher education space on where if we collaborate together can we really mutually benefit all parties. And so while this sort of feels for some that's a sort of a first-time model, not necessarily the case. We're really excited about its innovation in terms of the two schools coming together. But more and more, I think we're going to see the spirit of collaboration and shared work, and really the goal to serve students in the best way that we can. As we look at what we're trying to accomplish here in terms of the degrees that Bryan College of Health Sciences offer and the current degrees that Hastings College offers, is that some of the degrees themselves will come from the respective institutions, but what we might be able to do in terms of those degrees is provide some additive value. So for instance, at Hastings College, one of the most popular majors there is a business administration degree. Bryan College of Health Sciences has a healthcare administration management certificate. So one of the conversations we'll have is to see, well, is there an opportunity to take some pieces from the program that we offer, the certificate that we offer, and then look at how that might support the program at Hastings College, and then what would that look like at the end, and what fine-tuning might we need to do. So again, these are just initial conversations. It will be the faculty and those to sit down and really take a look at the curriculum, get to know each other, get to have those conversations about what's possible. And of course, while we're looking at sort of what we do existing and seeing if there's some opportunities to merge those, the other thing will be in those conversations, when you put faculty in a room, when you put the deans in a room, when you put staff in a room, is that of course you get a lot of other new ideas. So what we hope out of that sort of generative conversation is other ideas come up, and that may also include then, boy, if we were able to do that together, then let's call so-and-so who also does a piece of that, and let's see what it looks like when we put all of that together on behalf of what's meaningful for our students. So I think that's really the exciting part. Again, I think you can see that when I talk about curriculum development, it's really just going to be exciting to get everybody together, say hello, and sit them in a room and say, let's start to figure out some really stuff and see what's doable for us. So as we think about the 775 students we serve at Bryan College of Health Sciences, and we think about the legacy of the School of Nursing, it is our biggest program, our biggest undergraduate program. And so there are a couple of conversations we've been having around that, and particularly around South Central Nebraska. So as we look at the workforce challenges in healthcare, mentioned nursing in particular and specifically, one of the opportunities is what are the needs, not only in communities, Lancaster County and Lincoln and beyond, but what are the needs in more rural communities and out in South Central Nebraska and further out as well. And so part of that is, can we have growth here for the college in Lincoln? And then similarly, can we also have some growth to meet those needs of the hospitals, the clinics, the areas where those shortages are most acute? And how might we find ways to partner with those agencies as well, not just the two colleges coming together to have that conversation, but certainly everybody also has to play a key role on the clinical side. How could we build a model of support and really then listen to what the needs of those communities are in terms of that outcome, that educational outcome? So I think that's really where that intersection will be most helpful, really most interesting for us, is when we also sit down and talk with community leaders and community partners and say, what are the greatest needs? And then how can we work together to meet those needs? And so if we were able to then move forward, right, with that School of Nursing and a program and a degree in nursing, and imagine that we're able to add to that workforce supply out in South Central Nebraska while continuing to grow and maintain what we're already doing here, I think that's just a really benefit for across the state. So that's really the goal, is to see how we can make that happen.